Dr. Michael Szabo, a Toronto emergency room physician. Thanks for joining us. Masks. People are saying that masks are going to be with us for a long, long time. Are they going to be with us forever? I know it stops the spread. Are we going to get around this?
Well, I think they're going to be with us for the foreseeable future until we develop like a more durable solution to this, like a vaccine. But we don't know when that's going to actually happen. I think when we're sort of getting people together more, we're lifting some of the restrictions. I think masks are a really important part of mitigating the risks that are going to come with that.
Let's talk about mitigating risks. I grew up in a small town, Petrolia. Every time I walked in the house, my mother said, wash your hands, wash your hands. And if somebody spit on the street, they were almost run out of town. In Toronto, we've forgotten about washing hands. And certainly you see it on downtown Toronto, people spitting all over the place. Should we get back to basics? Part of this that we've lost basics?
That's such a great thing that you bring up. I think it's really important. Sometimes the most basic things are the most powerful. And in this situation, the basic things are washing your hands. If you're sick, staying home. If you're going to be around other people and you can't control the distance between you and other people, wear a mask. Those very sort of more basic things are actually proving to be some of the most powerful weapons in this situation.
Let's talk about the situation, particularly on young people, on students. They haven't been in schools for months. Some people are saying, well, we might get back to schools in September. In Europe, they're in schools now. We could have half the students in the morning, half in the afternoon. No socialization, no sports, no camps. Kids can't play together. And parents naturally are very upset. Is there a greater cost that we're going to have to endure as a society than these measures we're taking?
Well, we have to think about those things. There are mental health, costs to this, but we have to remember, that the virus doesn't care about our mental health. The virus doesn't care about our economy. The virus just wants to replicate. It wants to look for a situation where it can start to get into the population and jump from person to person. So I think it's important to try to develop a strategy around opening things up so that we minimize these risks.
Right.
But we have to realize that we need to, these situations are risky, that the virus is looking for an opportunity.
So Dr. Szabo, as a society, in order to deal with all these kids who've been disenfranchised, essentially, do we have to really fine-tune it and pay more attention to mental health of kids and to socialization of kids?
Yep.
Is that going to be something in the future?
We have to really think about that because it is a big risk of what we've done so far. But that's why people are working on this issue, trying to develop strategies for bringing kids back to school, for having summer camps modified this summer. People are working hard on that. I know the schools are looking at sort of staggered days, less people in the classroom. All these things, because, the long and the short of it is that when kids go back in school and they congregate together, there's going to be outbreaks.
Spike when that happens?
There's undoubtedly going to be outbreaks in schools. If we bring kids back to school in the fall, there's going to be. But it's about being able to identify when they occur, to sort of get those people tested, isolate them, contact trace, try to mitigate those outbreaks when they do happen, because they're going to happen when we bring people back together.
Dr. Szabo, you mentioned the magic word, testing.
Yeah.
Were we amiss at the start of this for testing? And people are still saying that we can't have enough testing.
Yeah, it's taken a while to ramp it up to the point where it is. I think we need to get it to that point so that we can open up safely and be able to identify outbreaks when they happen. And we're better now than we were before. But that's another reason, why there was a lockdown, was because we had to wait until we had a robust system in place to be able to deal with outbreaks when they happen.
And some editorial writers are saying one of the byproducts of this is going to be a greater attention, greater focus on nursing homes, retirement homes. Have we been lax as a society?
Well, I think the nursing home situation has been absolutely awful. It's devastating. I think we probably could have done a better job. I think we'll hopefully be more cognizant of that going forward. But it is a situation that's ripe for an outbreak. People in close quarters, indoors together, multiple comorbidities. Unfortunately, they were just a population of people that are very vulnerable.
Okay. It sounds like we're all vulnerable these days, but thank you very much, Dr. Michael Szabo. Good chatting.
No problem.